Hello everybody, this is Suzanne Kellner-Zinck from Dawning Visions Hypnosis, and this is actually my very first Facebook Live on disappearing type 2 diabetes because we're getting some people into the group, which is rather exciting. Please do share it with the people who you know who are men who have type 2 diabetes, not women, men. Why? Because men do not like going to doctors, they do not like getting bad news, they do not like wasting their time. They just want to get information and act on it. And actually, my best friend who died of heart disease due to the type 2 diabetes, he was only 57 years old, was in the situation. Although he did go to the medical doctors to get help, he didn't get the help he needed. He was basically killed on the operating table, getting a heart stent when he was not stabilized enough to take that operation. So that's why I started this group, and that's why I am really clear that we need to get things straightened out here, especially where men are concerned. Because another thing that I realized, I found this interesting, I joined a bunch of other groups, a few diabetes groups. I actually was almost thrown out of one, but that's okay, whatever. Mostly it's female people who are in those groups, not men. Although men will Facebook a strange woman as if they want to get a date, they don't even know you. Yes, it just happened to me again. I made the guy know. He lives in Turkey. He's in the American military. I don't even believe in America anymore. Don't want to go back. Probably will keep my American citizenship, but I don't have any interest in living there, given the policies of the country in every area. Seriously. But that be it as it may, it's important for us to understand why it is that things are done the way that they're done. Because many times things are done that make no sense. Like wearing a mask against a virus that doesn't exist, for example. I have a bunch of stuff on that on my personal page on Suzanne Kellner-Zinck. But what I want you folks who have type 2 diabetes to know, first and foremost, if it's a new diagnosis for you, you've probably been having problems for about a decade before it actually showed up in the A1C blood levels. About a decade. And what happens is, just to give you a little lesson in physiology, your insulin is unable to get the glucose, what we call sugar in the body, to the cells where the cells need them for the energy. When that happens, your blood sugars go up and you get what's called non-alcoholic fatty liver disease. Fatty liver happens because the sugar is stored as fat in your liver. That's where it goes. And then when there's so much fat in your liver, your pancreas gets full of fat. And when that happens, your beta cells in your pancreas can no longer make as much insulin. So you're either insulin resistant or you're not making enough insulin as a type 2 diabetic. So the first question you need to ask yourselves is, why are doctors in the conventional medical world giving type 2 diabetics insulin if they're resistant to the insulin in the first place? Well, that goes back to what I was talking about, the nonsense of how the world works for the people who have money, who want to make more money and kill people in the process. Obviously, if your body can't handle the insulin that it's already not making enough of or isn't able to work with it, having more insulin when the problem's insulin resistance is going to make you more ill. You don't have to trust me on this. I'm not a doctor and I don't pretend to be. But if you actually look at the things that Dr. Jason Fung, he explains it in layman's terms so that a person can understand it on his YouTube videos, or there's other doctors out there who are talking about this stuff for what it is, who realize that it's not a matter of getting your blood sugars down. Unless your blood sugar's in the 400, 500 level, because that is definitely a problem, Blood sugars being high is a symptom of the illness. It is not the illness. It's sort of like saying that putting a Band-Aid on an abscess is going to take care of it. You have an abscess because you have a bacteria in your body which needs to be killed with an antibacterial ointment of some sort. That's how you get rid of it. Pain from it, redness from it, symptoms. If it's oozing all over the place with pus, it's a symptom if you have an abscess. So, the blood sugar will go all over the place if you follow the diets that your conventional doctor will give you, most of them, because they're not addressing the problem. Now, you don't need to have a fancy diet that's foreign to you in order to be able to get your blood sugar levels down and to reverse this. Not at all. What you do need to do is you need to stop eating simple carbohydrates, no matter how delicious they may seem to be. Simple carbs like bread, white rice, white anything actually. Get all that stuff out of your body. Flour, pasta, all that stuff breaks down to glucose and your body can't break it down because the insulin is not working. Stop those foods. High fructose corn syrup is in every freaking thing that you can buy practically over in America because it's a lot cheaper for the manufacturers to use, including Coca-Cola. I don't know if you know this, but after living in California, Southern California, their Coca-Cola that you get in the Mexican stores and restaurants in a lot of California is actually still made from cane sugar. Anywhere else in America, high fructose corn syrup. Go figure. Stay away from that shit. It's in Heinz ketchup. Stop using it. Go to Hunt's. Hunt's doesn't use it. You want to be wary of these things. Stress. Stress is the thing that kills most people because it kills the immune system, and without an immune system, you die. What do you have in your life that's causing you stress right now? If it's the news, turn it off. That's easy enough to do, isn't it? If you get newspapers, read the stuff that you're interested in and leave the rest alone. Most of it has no basis in reality anyway. Walter Cronkite died, and I think our news died with him, sadly. Get sleep. Less than 4 hours of sleep deprivation. That means having 4 hours less sleep than what your body requires. Can elevate the blood sugars. You need to get sleep. The melatonin starts being released in your system around 9 p.m. I'm not really good at going to bed at 9 p.m., but you want to go to sleep 9, 10 p.m. so you can get sleep that your body needs to go through the sleep cycles. It needs to go through like 4 complete sleep cycles for you to feel rested for most people. If you're older, you don't require as much, and it's harder for older people to get sleep, but that's why meditation or self-hypnosis practice would certainly help you. If you're more religious, prayer puts you into a meditative state as well. Yes, indeed. Those things will help you. I would totally get into the mindset that you can reverse this thing as I got rid of a brain tumor I had. I visualized the sucker away. Because the doctors, even after $300,000 worth of proton treatment, could only stop it from growing. They could not get rid of it. She was a neurological radiologist doctor. Chinese. Brilliant. And truthfully honest. 2 years later, I went in for the second year MRI, and she said if it was any smaller, it wouldn't be there. I'm imagining that all these years later, it's gone. So if you make a choice to get rid of something, you can usually get rid of it. Your mind's an amazing, amazing vehicle to do that. I did the same thing with bipolar 2, actually. They tell you in the psych world that you'll have that forever, and I wasn't going to be on medications forever, especially after they started hindering my kidneys operation. Can't live without kidneys, people. Detoxifies the shit that was going through my body in the world of lithium at that time. And I did find a way to release it in 5 minutes of timeline therapy with Tad James. Thank you very much. So I haven't had to take any medications for it, nor have I had to see a shrink in many years. Many, like since 2005 for the shrink, although I loved her. She was wonderful. And 2004 for the medications, which is a really good thing. She released me. Happy to see I was doing very well. She followed me for 10 months. So those are a few ideas that I want you to think about to own your own life, your own health, your own bodies. Because you can indeed do something proactively to help yourselves. You do not need to be victims of a crooked medical system. You do not need to be victimized by people who think they know better than you and they don't know what the hell they're talking about. I've been in the world of medical sciences since I was 13 at the animal hospital, 16 with my dad, the dentist. We all had to work in his office. This stuff is in my blood. Got a master's in medical sociology. Did a couple of years in nursing school, decided it wasn't for me. And I've done a lot of stuff in mental health over the years. I have a pretty diversified background. My clients heal if they do what they're told. Usually, what they're told is what comes from their unconscious minds. Because your unconscious mind knows exactly what you need. So I'm going to end it there. I have a paper I got to get written for school. I am in school doing a second master's in peace and conflict management, where the world is even crazier. We don't have governments do really ridiculous things behind other governments' backs. Yeah. Of course, in diplomatic simulation. Diplomatic simulation taught me a lot about that. Yeah, incredible. In any case, I thank you for watching until the next time I get on. And I want you all to just know that you have the power inside you to take care of yourselves if you allow yourselves the ability to think and do for yourselves. Okay? All right. Have yourselves a lovely day, evening, or whatever, depending on when you're watching this. Until next time, I thank you for spending your time with me till next time.